Total joint replacement. Many people are turning to it for relief from pain in their hips and knee joints.
I did certain things that I was just going to be in such pain that it wasn't going to be worth it. Now I never give it a thought.
We'll take a close look at how some doctors are using computers to assist them in surgery, and some remarkable stories about how joint replacement surgery has changed the lives of many people right here on the Central Coast.
When you live what I lived before and you live what I live now, I don't know how else to describe it but a miracle. I really don't. It's that profound to me.
That and more next on Lifeline TV. Hello, I'm Dr. Bob Morali. You know, every year more than 400,000 people nationwide undergo total joint replacement, relieving pain, restoring independence, and returning to their daily activities. The only center of excellence for joint replacement on the Central Coast is right here at Salinas Valley Memorial. We have a dedicated program that provides comprehensive integrated care by a team of highly trained specialists.
Joint replacement has been identified as a center of excellence at Salinas Valley Memorial Hospital. A patient coming to our joint replacement center has the benefit of state-of-the-art surgical techniques and specialized nursing care at every step of the process, which typically leads to more rapid recovery from surgery and better outcomes once the patient returns home.
Our thinking is always, what can we do to be better? If we could certainly sit back on our laurels and say the joint replacement is a very successful surgery, why mess with it? On the other hand, I think if you're anybody who wants to provide the best services possible, you are going to think, well, what else can I do? What else is possible to make this even a better surgery for the, like I said, not just for the doctor, but for the patient, you know, so they have a better experience, they have a shorter recovery, less pain, up and around quicker, and I think our joint replacement center will certainly help patients achieve that goal.
The joint replacement center concept, the benefit of that is that the patient is, I think, more involved in his own care. The patient comes into the operation more informed as to what's going to happen. For example, in addition to the information that they'll get in our office, the hospital frequently will have them go to a pre-surgery conference where they will be instructed in what to expect, what they're going to have to do to make this a successful operation.
A good result is not just well-performed surgery in the operating room. The rehabilitation is equally important, if not more important. And so if the patient is prepared to go through that process with enthusiasm and vigor and is very focused on getting better, then they're going to get better quicker and have a better result. And so the program here will support that whole process. Preoperative teaching, a very supportive environment in the hospital, from nurses to therapists to discharge planners.
I'd say one of the major differences with the joint replacement program at Memorial Hospital is that you do have physicians that are local to the community and are sensitive to patients' needs. We see you in the grocery store and you're not just a number to us. Here in Salinas you'll have your own surgeon, develop a rapport with them, see them preoperatively, postoperatively, in the operating room, in the making rounds with you in the morning and in the evening, and making sure that all your medical needs are attended to.
We're all working to gain more knowledge on the newer techniques, the more advanced techniques, use the more advanced equipment, and the hospital as well, the nurses, the staff, all focused on the outcome of this as a successful outcome.
Joint pain often occurs because of osteoarthritis. That's when cartilage in the joint deteriorates. As bone rubs against bone, pain increases while comfortable movement decreases. You know, many people experience pain for years, mistakenly believing that they're too young to suffer from joint problems or that nothing else can be done.
I just was in constant pain, and the pain just kept getting worse and worse. I think one of the most painful things was getting in and out of the car. I just felt I wish I had a sling that I could swing myself into the car and not have to stretch my legs or bend. Or for me, it was just the pain.
The pain was it was a gradual process that grew over a period of probably 10 years. When it comes on like that, you don't even realize that it's happening to you. You just adjust.
When you start really things that you have to do or you want to do, and all of a sudden you find yourself you can't do them, that's when it's really frustrating. When you can go up in the hills, it's hard to walk up hills. And coming down was even worse. That was terrible. There's
not a moment that you're free of it, and so it just gnaws at you, and it downright hurts. So you just don't have the energy to do anything.
Whenever we would get together with family, Gene would just basically be sitting. I mean, he was not involved with the grandchildren because he couldn't really hold them, he couldn't chase them, he couldn't walk with them. So we were pretty sedate.
You know, for the year before, he literally couldn't do anything. He couldn't dance, he couldn't bike ride, he could barely walk. He was in pain, sleeping, waking, every moment. So really what I saw in him was pain and misery.
Yeah, he got kind of cranky when he wasn't feeling good and when he couldn't do what he used to do, you know.
I just had all of this pain, and it was, you know, just affecting the quality of my life, because I knew if I did certain things that I was just going to be in such pain that it wasn't going to be worth it.
What you see is a patient who starts with a lot of pain. That's what brings them to the point where they need the replacement.
The main indication for joint replacement is pain. Functional limitations, loss of motion, the inability to perform at proper levels are very important, but they're still secondary. Pain is the main indication for the procedure.
Joint replacement can completely change people's lives. You take them from a state where they live in chronic pain to a state where they have no pain.
I think that the main reason why a person should have a joint replacement surgery would be if they're unhappy with their activity level and their pain is limiting their activities. Joint replacement surgery is the primary purpose is to minimize their pain and allow them to do more.
Some of the criteria we look for are just standing less than 5 or 10 minutes without really significant discomfort, looking for a chair, looking for a place to sit down, walking less than a block of tolerance, and that's walking with somebody who has no arthritis, that walks at a reasonable pace. Inability to just put your shoes and socks on because you don't have the flexibility to get them there. You start wearing slip-on shoes all the time because you can get them on kind of through different means. And then there are other things as well. People who are no longer able to adequately exercise their heart and their lungs because of pain. That's a big issue for a lot of our patients who have heart issues and need to stay fit. And a lot of times the knees and hips will prevent that activity. So those are other issues that come into play now.
A lot of them come in and say, my lifestyle is impacted. I need to be able to get back to these things that I used to enjoy doing. I'm gaining weight because I can't be active. I can't sleep.
People ask me all the time, Dr. Hershey, when should I have my surgery? And my usual answer is when your activity level has diminished to the point where you're not happy anymore because pain is limiting you from doing what you want to do. That's the time to have surgery.
And so the people who are candidates for joint replacement are people who have significant pain. Obviously that's a relative term, but significant pain, and people who have failed reasonable conservative treatment. You don't want to go into a surgery as your first option. It's your last option when other non-operative things have failed.
Joint replacement is a surgical procedure in which a worn out or injured joint is replaced with a metal, ceramic, or plastic joint. In a total knee replacement, the damaged surfaces of the kneecap and leg bones are removed. The surgeon then replaces them with precisely engineered components of metal and state-of-the-art plastic. These components fit so snugly that the patient does not even need to wear a cast following surgery. In a total hip replacement, the surgeon removes the top of the femur and the diseased tissue in the hip socket. A new cup-like socket is inserted into the pelvis, and a canal in the femur is hollowed out. Into the canal fits a long, sturdy metal stem topped by a ball. The ball glides smoothly into the socket, restoring easy movement.
Well, this is a demonstration of a pelvis and a femur, and where they join is the hip joint. And this is how a hip moves. It's a ball and socket joint. When it becomes arthritic, the motion becomes limited and the motion becomes painful. What we do is to substitute a metal and plastic joint for the native one. And we do that by replacing the component in the hip, in the pelvis, with a component such as that one, and put this stem down into the femur to substitute for the ball part of the head, and this is what the result is. You have the full range of motion as you would beforehand. The knee joint replacement is similar to the hip, is resurfacing the joint. So if you look at a native knee from the side, here's the smooth cartilage surfaces, and the kneecap would ride around here. And you can see that this implant would basically cap this portion of the femur. The bone is cut appropriately, and currently we're using a computer to help us make the correct cuts. And then on the other side, this plastic tray would reside on a metal portion that would go into the leg bone, the tibia bone, and these would rub like this.
The results that we get are generally a lot of pain reduction. That's the main thing. Pain reduction and improvement of their activity levels, increasing their daily activities without pain, and their leisure, a lot of their leisure activities are improved also.
I had a total hip replacement at Salinas Valley Memorial Hospital.
I love this, bilateral total knee replacement. I had both knees replaced at the same time.
Well, a couple of years ago I had my left hip replaced, and then about 20 months after that, which I guess was maybe about 3 years ago, I had it replaced. I had the second one replaced.
I had both my knees done at Salinas Valley Memorial, and I'm very pleased with it.
The surgery was 7:30 in the morning. I was out of surgery at 1:15. I was conscious vaguely at 4 o'clock, and by 4:30, those nice nurses at Memorial had me on my feet and walking across the hall. Now, I didn't walk very far, but I walked.
After surgery, I was walking, and the very next morning, they had me walking.
As soon as the medication with the anesthesia and all that stuff wore off, there was some discomfort. I don't want to say there wasn't, but the pain that I had been in before they put me to sleep was gone. It was all gone. Every bit of it was gone. I was on a machine that was moving my leg already, and that pain was gone. It was totally. It was a different kind of pain, and pain's really not the word, because it's just discomfort. It's a lot of discomfort. It's real stiff, and but compared to what it was 6 hours or 7 hours before, it was gone. It was magic. It was just absolute magic, and I don't know how else to say it, but they just did magic on my knees.
I would say by the end of the second week, he was back to work, not physically working with the tools, but he was back, commuting back and forth and checking his jobs, and, you know, out talking with his clients and talking to his carpenters.
I had the surgery a month and a half ago, and I can do just about anything I want to. Yeah, hunting, walking, you know, moving hay around to feed the cattle and the horses, working in the garden, just going shopping.
And the whole operation was a total success, just unbelievably. And the relief that I got, and I really never had much pain, even in the recovery time after that.
So after the surgery, you know, I didn't have the pain anymore, which is that's a blessing. Just walking, it's 100% better than what what I had when I was before the surgery.
One of the many advances in joint surgery is called a minimally invasive procedure, which for many people means a much smaller incision, shorter hospital stay, less time for recovery, and less trauma on surrounding muscles and tissues.
Basically, it is a mindset that says that you want to do minimal trauma to soft tissue to accomplish your goal. Your goal is still to put the prosthesis in properly. That's job one. The techniques have evolved to allow you to do it through a smaller incision, but the approaches have also changed in that we don't go through muscle planes that we used to go through. So there's less trauma to soft tissue as well as a smaller incision. And so that combination has come to be known as MIS, minimally invasive surgery.
We try to cause less trauma to the soft tissues by making incisions that go between the planes of the muscles rather than through the muscles, or making smaller incisions, because basically we feel that making a smaller soft tissue exposure allows the patient to heal more quickly without as much pain.
So long as we're able to see what we need to see and make the corrections that need to be made, smaller is tending to prove out as better.
The benefit is that the operation is usually less painful. The recovery is usually faster. The blood loss is frequently less. And frequently the hospitalization is less too.
And that's a tremendous boon for the patient. Usually means less pain, a quicker recovery, and a quicker return to their activities of daily living.
The basics haven't changed a lot, but I'm almost doing nothing I did in residency the same way. We did knee replacements, we did hip replacements, hip revision, but now we're using different approaches to the hip. We're using more advanced technologies in the knee. We're using smaller wounds in both procedures that nobody envisions, and I'm sure if we were to all go back 10 years, we'd all poo-poo the concept.
Another advancement in joint replacement surgery is the use of computer-assisted navigation to guide placement and align the new joint.
So now we're actually creating the model of the patient's tibia, drawing all over the bony surface so that the computer then knows what the limits of the bone are. So we tell the computer where the end of the femur is, and then what's the shape of that condyle by just kind of moving it all over, gathering data points.
Currently the technologies are changing in terms of computerized navigation for knees, smaller incisions for joint replacements and things of that nature. But in general, we're doing a very similar operation. The technology is proven and has been effective for a long time.
She's bow-legged 3 degrees, and she lacks full extension by 6.5 degrees. And now she's no longer bow-legged. She stands up straight as an arrow through the knee joint.
We are at the forefront of the technology in joint replacement. There's no reason to leave the area. In fact, we're the only facility south of San Francisco and the only facility north of Los Angeles that has the computer-assisted technology at this point. What the computer allows us to do is develop a computer model, and so that we can see parts of the lower extremity that we were unable to see before.
The computer renders an image of that person's anatomy. So if they're 5'6" and they have a really bowed leg, the computer now knows that. And then it will instruct us as we're marching through the replacement process, the corrections that need to be made so that the joint now is aligned in an optimal position for future wear and activity.
In computer-assisted surgery, we can get the exact alignment of the lower extremity. And 3 points that we want to align are the center of the hip, to the center of the knee, to the center of the ankle. That's called the mechanical axis. And the beauty of the computer is that during surgery you can only see this portion of the lower extremity from my hand down to the ankle, and you can't see the center of the hip. Here we can see he's got about 5 degrees of varus, which means he's bow-legged about 5 degrees. On the left screen you can see the green line. That's where his mechanical axis is. That's where all his weight is. The center of gravity goes right through the most arthritic part of his knee. And we're going to try and get it to the orange line there. With the computer, we do some modeling in which we rotate the hip, and then the computer finds the center of the hip. And then we place a couple of marks on the ankle so we can find the center of the ankle. And then we have a wand where we mark the knee. And what we are able to do with the computer is get a perfect mechanical axis from the center of the hip to the center of the knee to the center of the ankle. So that allows a pretty much perfect alignment, just like the tires in your car.
The main difference in our lives is that now, instead of sitting in the house, we're doing things. We're out walking and traveling and backpacking and shopping and dancing.
Playing with our grandchildren, doing a lot of the social things that we had put off because, you know, we couldn't do them before.
And sleeping, you know,
that's
comfortably.
right, getting a good night's sleep.
Yeah.
It's been wonderful.
There's no comparison now. He's just a lot happier, and I'm very glad he did it, yeah. It's made things a lot better to see him more comfortable.
Every day when I'm just walking or doing anything and I think this doesn't hurt anymore. I walk a lot because I enjoy walking in the first place, and in the second place it's good for me. But I don't have any pain anymore. That's the big thing.
Since the surgery, not only am I functional, but I'm back doing the things that I like to do again. I'm back riding my bike, we're back going to the beach. A couple of nights ago, Kathy and I got up and here in the house all by ourselves, got up and danced to a couple of songs again, so I'm getting to dance again. I've got my boat back up on top of my truck, and I'm looking forward to getting back in the water, maybe catching a wave or two.
Gene used to exercise. You know, he would always use his exercise bike, and I would use the treadmill, and all of that stopped because he was in so much pain. So consequently, we gained a lot of weight. And I would say that as soon as he had the first surgery and then he went into his second surgery to do the other hip, we've lost quite a bit of weight just because we're back to an active life. It's changed our lives. Now we're back to where we were 10 years ago. We're camping, we're hiking, we're walking.
And we're shopping.
It's much easier to perform the day in, day out task at work and here around the house. I can mow the lawn again. I can
clean the house.
Clean the house.
Wash windows.
Wash windows.
That's wonderful.
All the things that need to be done in everyday life that you don't think about, that most people don't think about, that are affected by what I was dealing with before. It's all back to normal. It's back to doing it and not even thinking about it. I'm smiling a lot more now. Numerous people have said, "You look like you've lost weight." A buddy of mine's wife looked at me and said, "You haven't lost weight, you've lost all that pain." And it's been a visible change, unperceptible to me, but a visible change in my face that people can look and they know something's different. And she put her finger on it, and she's absolutely right. It's gone.
2 weeks ago, I went into the plumbing shop, and I hadn't seen those guys for probably close to a year and a half, 2 years. So there was a long period of time that they hadn't seen me. And I walked in there, and they said that, they asked me, "Well, how are your hips? You seem like you're 20 years younger," which I thought was pretty nice coming from a plumber. I said, "Do I owe you any money?"
It's a gift. I mean, you know, a lot of people have done a lot of research and a lot of hard work, you know, at a lot of places that I don't know anything about. But all of them, I'll say thank you, because they've all changed my life.
I'm just so thankful for this entire procedure and process, the hospital, the doctor, the knee surgery. It's made a huge difference in our life.
But I sure recommend it. I don't have any regrets. If I had to do it again, I would. No hesitation.
People think, should I do it now or not? And it's like, I do it now. I mean, why wait?
Based on my experience, I wouldn't put it off any longer than you absolutely have to. So if I had it to do all over again, I would do it in a minute, because it just gives you a new lease on life. It's just wonderful.
Having gone through what I've gone through, I would say to anybody else who's thinking about it, don't hesitate. If your doctor thinks you're right for it, run to it. There's nothing to be afraid of. They'll take care of you, and if you do your part, they sure do theirs.
You have to apply yourself and exercise and keep it. You know, you have to help yourself also. It's not like you go in the store and buy something and it's fixed. You know, they're going to help you and they're going to fix it, but there's part of you that has to do it, as far as the mental and physical therapy and all that stuff.
Memorial Hospital did a fabulous job of just sticking with the technology, I think, and making it so much easier. It was professional, and I felt like I was being well cared for by people who cared about me. And I think that is very important, you know, to have a nursing staff and therapists that care about you getting well. And Salinas Valley Memorial Hospital did a fabulous job providing those kinds of people to take care of me.
You've got to trust that at Salinas Valley Memorial Hospital, they are going to do the best surgery that you could possibly have. You will be so happy. It'll turn your life back around. It'll give you your life back.
They were really good to him. Just, I mean, they were there in a flash.
Yeah.
If he needed anything, they were really good.
The doctors and the staff are all very, very professional, put it that way. They did a good job and they treat you well, and that's what it's all about.
Those people were so magnificent, from the people who brought in my dinner to the people who took it away, to the nurses that gave me the medications, and everybody was so incredible. And the physical therapists came in, they were terrific too. Just, you know, everybody. It really felt like it was a team effort. Everybody was doing everything they could, and it seemed to me they were all doing it just for me. You know, that's what it felt like. But the nurses, the doctors, the physical therapists, everybody, they made me feel like I was the only one that they were taking care of.
Salinas Valley Memorial Hospital did a fabulous job. And if I had a third hip, I'd have it done here too.
If you'd like to know more about the Joint Replacement Center at Salinas Valley Memorial Healthcare System, visit our website at svmh.com. See if joint replacement could help you get back to what you enjoy. Thanks for joining us. I'm Dr. Bob Morali. See you next time.